Hi, it's Dr. Ann Zink with a brief update with what's happening in COVID-19 in the state of Alaska. So, as most of you know, the majority of our state has had a real surge in cases, and our entire state is in the red alert level right now with greater than 10 cases per 100,000. And we're averaging across the state 60.32 cases per 100,000. We've seen an 18% increase over the last week, and this is our sixth week in a row of an increase. Nationwide, we're seeing an increase in cases, particularly in the Midwest, and we, like many other states, are surging right now. We continue to see cases primarily coming from socialization when people let down their guard and cannot maintain both distance and masking, particularly in communities and in indoor closed spaces. We continue to see our hospitalizations be stretched thin and continue to see an increase in hospitalizations across the state. Approximately 11% of our patients right now in the hospital, so just over 1 out of 10 patients in the hospital right now, are because of COVID. And we have over 100 people in the hospital right now because of COVID-19. This is another data point that I like to look at, and this is what we call syndromic surveillance. Syndromic surveillance looks at the people showing up to an emergency department and what sort of symptoms they're presenting with. So in the blue lines, you can see COVID-19 versus the yellow lines, you can see influenza. And the basic takeaway from this is that you can see COVID-19 cases really are surging in what we're seeing in the emergency department as well as the inpatient, including a difference between what you diagnose as well as COVID-like symptoms. But we don't see a big increase in influenza. That dotted line at the very bottom is the number of influenza cases diagnosed in the state of Alaska. And we continue to follow this on a weekly basis. On the next line, we can also see the ages. So continue to see all ages increasing, but particularly the 20 to 39 age group. We've started to see a slow flattening out of the 0 to 19 age group, and we're hoping to continue to see a downward trend. Remember that if someone in your household has COVID-19, a mask in the household can help minimize the transmission within your house and hoping to protect people in the house with someone with COVID-19. Our positivity rate continues to increase, and unfortunately, we're reaching about 10% of our cases that are positive over the last 7 days. You can see this is the sixth row that we've had this increase in positive cases. This next graph comes from a paper from the British Medical Journal that I like because it really shows kind of the viral genome, how much virus someone has compared to when symptoms start. So here you can see that the virus that someone sheds is highest right as someone is becoming symptomatic. So they shed a lot of virus before symptoms and right at the very beginning of symptoms, much more so than when there's severe illness later. And this, because of this kind of asymptomatic and mildly symptomatic spreading, is why this is so hard to control. So interesting graph to take a look at. Here's another comment about just home gatherings and what I had mentioned previously. But if you are in a home with someone that has COVID-19, having a cloth mask and a well-fitted cloth mask can definitely help to minimize the spread of COVID-19 within your household. I would also encourage people to take a look at the new CDC guidance regarding masking and how a mask not only can help protect others, but can also protect you from COVID-19. We all know that the holidays are coming up, and this is not the time to travel, and this is the time to gather distance. So being able to do this by phone or remote, being able to take food to friends and neighbors and checking on each other, but really doing what we can to slow the spread of COVID-19 across the state. As mentioned, this is also a time to mask up. And so check out the new CDC recommendations as well as the scientific findings about how a mask not only protects you, but also protects those you're around. So take a look at those. We are also in the midst of active vaccine planning. So it's not currently available, but we do expect vaccine before the end of the year in limited quantities. We'll continue to get that out as quickly as we get it and continue to provide information and updates with where we're at. So Alaska, this will not last forever, but as we're seeing our cases surge, our hospital capacity becoming limited, this is the time that we need to avoid all indoor spaces where you cannot mask and socially distance. This is the time to not travel and to be able to care for your mental and physical health in a safe and effective way. So take care, be well, and I'll provide more updates soon. Thank you.